Interviews with top newsmakers, leaders, and interesting people. This is Talk of the Tiers.
Welcome to Talk of the Tiers. This week, we're going to talk healthcare, most specifically Centralus Health, which is a merger of Cayuga Health and Arnett Health. And with me today, I have the two top dogs of those organizations, Dr. Martin Stallone, who's the CEO of Centralus Health, and Jonathan Lawrence, who is the Executive Vice President of Centralus Health. And you've been here before. Thank you for coming back, and thank you for being here for the first time.
Glad to be here.
All right, I start this program the same way every time. I want you to verify, if you would please, that we have not discussed any of the questions that I'm about to ask of you beforehand, and you'll be hearing the questions for the first time as I ask them.
I can agree to that.
I think that's important. Okay, Dr. Stallone, let me start with you, because I'm not so sure that a lot of people in our viewing area know much about Cayuga Health. Mm-hmm. So you're bringing that organization into well, you have brought, because the merger's done. Yep. You're bringing that into the merger with Arnett. What does Cayuga Health do, and why was it a good idea? I'm going to ask you the same question, Jonathan, about why. But what should we know about Cayuga Health that we don't know?
Sure, happy to explain Cayuga Health. First of all, thank you for having me here and us together here. I think it's important that people get to know Centralus. Centralus, as you mentioned, is the coming together of Cayuga Health and Arnett Health. Cayuga Health is a health system in and of itself. It's a two-hospital system, Schuyler Hospital and Cayuga Medical Center. Like other health systems, it has a large physician practice. Our physician practice is called Cayuga Medical Associates, but we have other capabilities as well: home nursing, substance abuse rehabilitation, transportation services, durable medical equipment, and we regard ourselves as an integrated delivery network. And what we try to do with our hospitals, provider services, and other healthcare delivery options is take responsibility for comprehensive care delivered to a population. We are centered in and around Tompkins and Schuyler County, and Arnett obviously is farther south. And we came together because systems are facing similar challenges, and to effectively face those challenges, we looked to a like-minded organization, nonprofit, mission-focused, similar cultures around being patient-centered and patient-first, safety-oriented, and we thought that our geographic proximity and our values and our common challenges and how we were approaching them made us good partners. And as I got to know Jonathan and his team more, and our boards met, the relationship compatibility became very evident. The state was very supportive of this merger, really an affiliation, and it's behind us now. Now we're working hard at coming together, creating value for the communities that we served, and frankly, I think it's going very well.
Mr. Lawrence, let me ask you this. Have operations in Arnett changed very much because of the merger? What's been added?
No, the affiliation really was consummated at the beginning of the year. And operationally, the impacts have been subtle, but in the long term, the benefits will be profound. In the short term, we've had partners to be able to work with collaboratively across the aisle, if you will, on a number of clinical, administrative, regulatory, legislative issues that are important to both organizations. And each day I get feedback and have experiences that support the fact that we went down this path. Jim, from previous discussions that we've had that I identified early in my tenure, and the board supported the notion that Arnett needed to be strategically aligned with another organization, just as Dr. Stallone described, one that is like-minded, shares similar values, a broad range of services, is committed to the people and the communities throughout this region. And so we feel very fortunate to have been able to work through the transition here and to be able to bring now Epic, probably operationally, the greatest impact and the greatest strategic imperative for the Arnett Health community and the organization. And so if there was one thing operationally that I would point to, it's all the work and effort that has gone into that implementation, and now the benefit that is being seen by both the employees and the patients that we provide services to.
Okay, two-part question here for both of you. You're trying to tell me the government tries to legislate health care? Please, no, that's being sarcastic. Let's talk about Epic, because I think I know a little bit about it. So what's the positive impact of having that now with both organizations?
Well, I think anyone can appreciate that we came from something like 7 or 8 different medical records serving the different component organizations of Centralus onto one digital platform. We did that in one felt swoop on March 22nd, and we did it along with other common IT platforms that put us on a level playing field and that accomplish a lot of the goals of our integration out of the box. And so we're able to have better insight into our performance, how we're treating patients, that we're able to have common operations across all sites that roll up under Centralus. It's a familiar medical record. People, it tends to be very prevalent in academic medical centers where people train. It tends to be the EMR, the electronic medical record in the country that's gaining market share the fastest. So it's a good platform on which we would rest next generation technologies that we intend to implement in the near future.
So if I have to go to see a doctor in Schuyler County, there's a doctor in I almost said Fresno, a doctor in Elmira will be able to see what happened in Schuyler just by opening up Epic and seeing it.
That's right. So what we do hasn't changed all that much, but how we do it, the tools that we have available have changed dramatically and for the better.
Okay. Well, we're going to take a 2-minute break and then we'll be back more to talk about healthcare again. Please stay with us. Welcome back to Talk of the Tears. We are talking healthcare, specifically Centralus Health, which is a merger between Cayuga Health and Arnett Health. I want to ask you both this. Jonathan, start with you. Walk me through how Centralus Health came to be. When were the first discussions? What was the impetus? How did it all happen? And I imagine there were some twists and turns involved.
Well, I think our first conversation was probably close to 3 years ago now, right, Marty. Mm-hmm. And you know, the healthcare community is relatively small, and certainly within our region. And the CEOs all get to know each other. And when Marty came into his role, he and I met early on, and we talked about the possibility of discussing where there are mutual interests and where we might be able to collaborate. And then COVID happened, and throughout that time, we kept in touch, as we did with other organizations and facilities, trying to work together to help each other in whatever way possible for the benefit of our patients and our institutions. And once we really were able to see our way through that, the conversations picked up again. And Marty is active in his regional hospital association. I am active in ours. And we also were able to identify other hospitals that were being challenged in similar ways and said, you know, maybe we should be talking together about how we can create the scale that we need to be able to be more efficient, to be able to provide better service, to be able to ensure sustainability, and how we would both be able to acquire Epic in a cost-effective way and be able to implement that across an enterprise as large as Centralus is now.
I would add to that when you said the COVID pandemic, this is one of the good things that came from the pandemic, was getting to know other healthcare organizations in the region. And I remember Jonathan and I would be on regional calls where we were calculating bed capacity. We were calculating how most effectively to distribute limited vaccine at the beginning, how to accomplish testing, how to do public health planning, and I think we admired both organizations for being forward-leaning. So I just want to foot stomp the COVID reason for coming together. But again, more broadly, health systems are challenged. I mean, obviously, we just saw the passage of the Big Beautiful Bill, and we're all wondering how that's going to shake out in terms of impacting community organizations like ours. But as we face these challenges, we realize we're not alone. And as we get to know each other and boards get to know each other, we realize that we're really all doing this for the same reasons in service of the communities, like I said before. And it just made all the sense in the world to deduplicate some administrative layers of the two organizations, standardize care across the region, and work together to overcome these challenges that are bigger than ourselves.
So you said a couple of things I want to follow up on. Let's start with Medicaid. because I'm not sure everybody knows, Medicaid is a state-run program, which is largely funded by dollars from the feds, and the feds are cutting back on that, ostensibly to try to remove waste and fraud. Are you concerned about coming cuts in New York's Medicaid program?
Yes, to the extent that those dollars right now are relied upon for what we do and how we deliver care. Regardless of how we rate the legitimacy or the appropriateness of those funds, right now we use them for our mission. And so I think everyone in our situation and leaders at health systems are wondering, how are we going to take cost out of the product to make sure it's sustainable? Sustainability, like quality and like safety, is an important consideration for healthcare. And the fact of the matter is, in this region, government payment programs like Medicare and Medicaid constitute critical funding for health systems like Centralus.
I'm going to take a pivot here with you, because one thing that I've been noticing here, I've been seeing all over the country, and I want to ask you if it's happening here, and it's directly connected to funding and whether people have effective health care, or even have health care. Are your emergency rooms seeing longer waits because people are using them for primary care, primarily because they are underinsured or have no insurance? And that, I'm seeing stories about that all over the country, and I was just wondering if it's happening here.
We have had a focused effort on making sure that people are waiting as little as possible in the emergency room. We are seeing still a significant number of patients in the emergency room each day. What we're seeing are an increasing number of behavioral health patients.
Right. Oh,
people in crisis because their safety net was lost during the pandemic, and the ability to keep up with the demands of that population is especially challenging. There are not enough psychiatrists, there are not enough social workers, there's not enough outpatient capacity to be able to provide the support that people need in the communities. That, combined with the loss of insurance now that we're seeing and what we're expecting as a result, and some of the challenges we have in the workforce. We saw during COVID that there were a large number of cohorts of nurses, physicians, mental health professionals, social workers, and others that took the opportunity to retire. And we've known for many years now that there simply aren't enough people coming up in the ranks to replace those. There is a large gap between the need and the workforce that's available to replace that need. And so that, as much as anything, is a contributing factor to waiting times for appointments, not only in the emergency room, but in the outpatient side of things as well.
Okay, I want to follow up on something you just said when we came back. We've got to take a 2-minute break. We'll be back to Talk of the Tiers in 2 minutes. Welcome back to Talk of the Tiers. We're talking the Centralus merger, the new organization called Centralus Health. Dr. Stallone, one thing that I've noticed seems to be something that's really needed. Arnett has operated its own nursing school in order to be organic, I guess is the way to put it. You bring them in and say, stay and work with you. Does Cayuga have anything like that, or will you be adding it?
No, that was one of the features that really attracted us to Arnett Health. We both have capabilities and resources that complement the other system. That was certainly something that attracted us. We have a partnership with Tompkins Cortland Community College, and so we train a lot of nurses, but having the school itself organic to the organization is essential. I mean, I couldn't agree more with what Jonathan said about workforce being at the heart of many of our operational challenges. And last count, I mean, I think there's something like 1,400 or 1,500 nursing FTEs across Centralus, by far and away our largest community of professionals. So I think the School of Nursing is a complete asset to us. We do intend to grow it. Nursing is part and parcel to a healthy health system, and we want to invest in that.
Well, I've had the misfortune to spend a few nights with Arnett. Just a couple of times, and it turned out to be fine. But I will say this, and as a journalist, I'm not making an endorsement. I will tell you, I was really treated well by the nursing staff. Really was. I thought they were very attentive and really wanted me to get better. All right, question. There's only one level 1 trauma center in this area. Any thoughts to you all trying to establish one?
A trauma designation is something we've thought about and we're entertaining. Level 1 has some specific requirements.
Right.
I don't think there's a need for 2 level 1 trauma centers, but I think that it would be good for us to enhance our trauma capability, and it's something that's on our roadmap of things to consider and then potentially implement.
Okay, let me ask you a question, Jonathan. I'm going to start with you. What do you think the particular strengths are that Arnett brought to the table that makes this merger work even better? What are the things that Arnett does so well that
You just mentioned it. Your experience as a patient and the care that you receive from our nursing team reflects, I think, a culture of excellence and commitment to service to our patients. Arnett's values of compassion, of excellence, of teamwork, integrity. These are things that we continue to try to cultivate and reinforce as we bring new people into the organization. And I think that really is the foundation for everything else that we do.
Same question.
Sure. I mean, I'd be remiss by not talking about some wonderful service lines that we have, our oncology, our orthopedics, our cardiology service lines, and I could go on. We've got some great clinical capabilities. I would say something that's unique about Cayuga among upstate New York health systems is our focus on population health, our ability to think about populations and aggregated statistics of how we accomplish care along any number of dimensions to control costs, to maintain aggregate levels of quality. So I would say we've got unique capabilities in population health, value-based purchasing agreements, partnerships with large employers and insurance companies. That's something that I think we brought to the table, much like Arnett brought a nursing school and it's a patient-centered culture. I think we brought the pop health capability.
You mentioned mental health. There are studies now coming out that show that cannabis is not the harmless drug we were sold that it would be, and that there are some serious cardiac mental health problems associated with long-term use. Plus, there are just environmental reasons. How do you attack the shortage of qualified mental health workers? Is there much you can do except for trying to be more aggressive in your recruiting?
We have subscribed to an integrated care model whereby we, with kind of oversight and embedding mental health professionals in practices, try to increase the surface area by increasing the number of practitioners who are able to take on some lower level mental health issues that in some primary care communities might be referred to mental health practitioners that are not readily available. In other words, transform primary care. And so in addition to that, we have invested in substance use disorder and mental health rehabilitative capabilities. We brought into Cayuga Health an organization called Cayuga Addiction Recovery Services. We have committed to do an integrated, an intensive crisis stabilization center in partnership with Tompkins County. And so mental health, substance use disorder, and transforming primary care to address those issues as well is a strategy that we've kind of taken up. And it's hard work and a long-tailed investment.
You mentioned emergency room and mental health. Right. I'm going to follow up with you on that.
Yeah, you may recall we also have a large graduate medical education program. So we train many different types of physicians at Arnett Health, among them psychiatrists. And we have been successful in recruiting psychiatrists out of our residency program. And so that has been very helpful to both the organization and to the region. And we've been able to also recruit successfully advanced practice providers, folks with degrees in mental health, as mental health nurse practitioners and physician assistants and other disciplines within mental health.
All right, well, we'll be back to wrap up this edition of Talk of the Tiers in 2 minutes. Please stick around. Welcome back to the Talk of Tiers. Talk of the Tiers. I'm here with the two top officials of Centralus Health. We got about 3 minutes left. So 10 years ago, if you were sitting here and I'd asked you that you would have the chance to participate and draw up a merger and make it happen of the scale that you've done, what would you have told me?
I would have said it's a challenging prospect, but one that I think is increasingly necessary given the landscape of the healthcare environment, both now and what is projected in the future.
10 years ago, I think it was a completely different environment, and I would have been a little surprised, but I am of the belief that healthcare is rapidly transforming. I know Jonathan has spoken in other settings about the rapid implementation of technology, and the world is moving fast. There's always been kind of a brewing cost crisis, a sustainability crisis, you might say. And so it was a little surprising maybe 10 years ago, but if you said 5 years ago, I would have guessed we'd be talking with, again, hopefully like-minded health systems that share our values.
People inherently don't like change. How have your staffs handled all the change?
We try very hard to make sure that they appreciate that the fundamentals of healthcare delivery are the same. They're going to be face-to-face with patients. These are the clinical providers and workforce, face-to-face with people, giving compassionate care that's patient-focused, safe, high quality. And then there is a requirement for us to think kind of one level back, certainly. How can we do it better? How can we do it more efficiently? How can we do it to the best standards that are known in our industry? So we spend a lot of time talking about our intentionality and giving people advanced notice of what we're going to do and how we're transforming and why we're doing what we're doing and why it's good ultimately for the communities.
Same question.
Yeah, I think people have embraced the change. The change has made their jobs easier. It's enabled them to focus more on the patient. And I'm speaking in particular again of Epic. And so it's been welcome change.
Right, got it. One really quick off-the-wall question, so we're about to run out of time. Mm-hmm. I think you guys have a great canteen, or you can go down and you get pretty doggone good food at a reasonable price. I unfortunately have had to use it a couple times. Is that just something that you guys said to yourself, we want a great canteen, or how did that morph?
Food service is an important thing. When you have 3,000 employees, making sure that everybody has appropriate access to a well-stocked cafeteria and nutritious variety of foods, absolutely critical to employee satisfaction, as much as patient satisfaction when you have patients that have a very wide array of dietary needs.
Yeah, I didn't want nutritious food. I wanted chocolate and junk while I was in hospital. Thank you, gentlemen. We're coming back for part 2 next week. I appreciate you sticking around.
Thanks for having us.
All right.
Thank you, Jim.
We'll have part 2 with these gentlemen next week. Thanks for watching Talk of the Tiers.